Hello, welcome back to The Secrets of what you always wanted to know and never dared to ask. In this series, we talk about pelvic girdle complaints. The topic of this 5th episode are MUS, or as we say in Dutch, SOLK problems. Nowadays, pelvic girdle and back pain are more and more considered as MUS problems. But is this justified? And what actually are MUS problems? MUS stands for Medically Unexplained Symptoms. So, physical complaints like pain, for which the medical world cannot find a proper cause. We really need to think this over. What exactly is meant by no cause found? Getting a diagnosis or finding the cause of a problem is often based on an assessment. For example, a blood test or some scan like X-ray or MRI. If these tests find nothing which can explain the complaints, then it is said that the problem cannot be explained physically. There are many different complaints for which it is hard to point out a physical cause. Think for example of pain, physical limitations, weird sensations, problems with digestion or problems breathing, and also some mental problems. A major problem is that with all these diagnostic tests, a lot, but not everything can be seen. We can show too much, too little, or even lacking of substances. And with imaging, we can see if something is broken or distorted. But what we usually cannot see is how it works, how it functions. The X-ray of this iguano does not show you how it moves. To do so, you will need to see him in live action. To understand functional problems is not easy. We need more knowledge and still do heaps of research. But we do know something. Let's have a look at some examples. In the previous clip on scoliosis, we talked about aberrant back muscle tension to diminish pressure on one side of the pelvis. This muscle tension may lead to all kinds of stiffness and back pain complaints, which will not show on an X-ray. To analyze this aberrant muscle tension, the spine needs to be assessed in other ways. Pelvic girdle problems often lead to diminished strength or capacity and loss of control, as clearly visible in this patient. With her there's no herniation, no conversion problem or other physically unexplained problem. What she is doing is the result of disturbed control over the sacroiliac joints. Proper therapy and training will improve her situation. And what can feelings of tingling have to do with pelvic girdle complaints? Well, to load the sacroiliac joints, they need to be compressed. This can be done by several distinct muscles, among which a little muscle in the buttock, the piriformis muscle. With pelvic problems, the tension in this muscle may be increased. This does more than give some soreness in the area of the buttock. This particular muscle passes over a thick nerve which runs into the leg. Too much pressure from the piriformis muscle on this nerve may cause tingling sensations in the leg. The pelvic floor, like the piriformis muscle, can assist in supporting the pelvic joints. People suffering pelvic girdle complaints often experience high pelvic floor tension. Instead of moving gently along with, for example, the breathing rhythm, there's a continuous high tension in the pelvic floor. This may not only give pain, but also deregulates defecation and continence. The abdominal muscles, and especially the transverse abdominis muscle, contribute to compression and thus control over the SI joints. Activation patterns of these muscles often change in patients with pelvic girdle complaints. As discussed in earlier clips, disturbed activation patterns of abdominal muscles may hamper breathing, which may cause symptoms like shortness of breath, loss of endurance, or hyperventilation. And what about interaction between pelvic girdle complaints and mental problems? For this we need to go back to Mr. Skinner. Just as his pigeons, we learn from responses to our behavior. If we don't understand our responses, like why pain increases, or that our bodies do not respond the way we expect, we don't get better, no matter what we do, then we get upset. We may become fearful and lose control. And sooner or later, this may even lead to mental depression. Sometimes, complaints cannot be physically explained, simply because there is no physical cause. But more often, causes do not lie in structural changes, but in problems with how we use our bodies, the way our bodies operate. If we start to really comprehend physical function, then many MUS complaints may actually become MES problems, medically explained problems. And so we've come to the end of this clip and this second series. We hope you got some thinking material and new ways to look at your patient's complaints. Do you like us to discuss other topics in this way? Just let us know. See you!